Are we ready? Okay. Yeah, I think so. Today is April 2nd. All right. Good morning. This is April 2nd, 2024. The time is few minutes past 10. The Insurance Committee of the Tennessee House of Representatives of the 113th General Assembly is now in session. Madam Clerk, please call the roll.
Representatives Sapicki, Davis, Freeman, Helton Haynes, Hemmer, Hicks of Hawkins, Hill, Johnson of Montgomery, Johnson of Knox, Lafferty, Mitchell, Ritchie, Rudd, Rudder, Sparks, Terry, Thompson, Vice Chairman Martin of Carroll, Chairman Kumar. Mr. Chairman, you have a quorum.
Thank you, Madam Clerk. Members, do we have any personal orders? Seeing none, I do have an important announcement that we've been saving for a while. NCOIL, the National Council of Insurance Legislators. National Council of Insurance Legislators will have their big annual meeting here in Nashville, April 11 through 14. And you are invited as a legislator. You will be an honored guest. They there is no cost for you to attend that meeting, or they'll give you a scholarship enough to cover that. They have also offered to cover travel expenses. So kindly consider it. I think it's very important that they are here in Nashville, and we are on the insurance committee. So it is expected that we will come and support them. It's our national organization. Need I say more? But kindly give it serious consideration. Hope a lot of us can attend. We'll plan to see you there. Our calendar today, we have 3 items on the agenda. Number 1 is House Bill 2147 by Representative Hill, carrying it for Representative Hale. Do I have a motion and a second?
Motion.
We have a motion and second. Chairman Hill, you're recognized, sir.
Thank you, Mr. Chairman. I've got an amendment 017362 that makes the bill.
Sure. So we have a motion and second to attach amendment 017362 to House Bill 2147. All those in favor, please say aye.
Aye.
Opposed? The amendment goes on the bill. Kindly explain us your amended bill.
Thank you, Mr. Chairman. This bill establishes 2 new additional means of obtaining wheelchair repairs. One allows independent repair persons to make some type of simple, non-clinical repairs without voiding the chair's warranty. The second is through an annual preventative maintenance visit conducted by a wheelchair supplier. These preventative maintenance visits will help extend the life of the wheelchairs while also guaranteeing users are not unnecessarily burdened with repairs that could have been caught early before failure. And with that explanation pending any questions, I request passage, Mr. Chairman.
Well, thank you. There seem to be simple common sense efforts. Members, do we have any questions? Seeing none, we are voting without objection. We are voting on House Bill 2147. All those in favor, please say aye. Opposed? The ayes prevail. The bill goes on to the
Thank you,
Commerce
Chairman.
Committee.
Thank you, Committee.
You're welcome. Item 2, House Bill 2076 by Vice Chair Martin. We have a motion and a second. You're recognized, but let's go ahead and attach your amendment. I have 015357.
That is correct, Chairman.
We have a motion and a second on the amendment. All those in favor of attaching House Amendment 015357 to House Bill 2076, please say aye.
Aye.
Opposed? The amendment goes on the bill. Chairman Martin, kindly explain us your amended bill.
Yes, sir. Thank you, Chairman and Committee. This bill was brought to me this summer from the Tennessee Medical Association after concerns over the recruitment process. So since nearly 2 decades since this statute had been updated, and I believe, especially with advances in technology, recruitment can be done more efficiently and transparently. Also glad to say that the TMA and the industry insurance industry have come to an agreement upon this amended language, as you'll hear about. There's 5 aspects of it. Provides the healthcare provider have 15 months to request a corrected payment made on the claim. A health insurance carrier have 15 months to recoup an incorrect payment. Requires health insurance entities to give a 30-day notice to the provider if they intend to recoup monies, and requires a notice to contain detailed information specific to the recoupment. Provides the future claim reimbursement to the healthcare provider may not be withheld until all recoupment appeals are exhausted. Establishes that recoupment may only be for the overpayment amount for the entire and not for the entire claim. And then finally, insurance companies will no longer be able to use extrapolation practices to determine the amount of the recoupment. With that, Mr. Chairman and committee, I humbly ask for a positive and stand for your question.
Well, thank you. So recoupment is when insurance company overpays and then they discover that they want to go back. I had hoped you were going to try to outlaw recoupment. Okay. Do we have any questions? I think everybody's in agreement. Without objection, then we are voting on House Bill 2076. All those in favor, please say aye. Opposed? The ayes prevail. Bill goes on to Government Operations Committee. Item 3, House Bill 2857, is also by Chairman Hill. We have a motion and a second. Chairman Hill, you're recognized. I see an amendment also.
Yes, thank you, Mr. Chairman. I've got amendment 013830, again, which makes the bill.
Very well. We have a motion and a second. All those in favor of attaching amendment 013830 to House Bill 2857, please say aye. The opposed? The ayes prevail. Kindly explain us your amended bill.
Thank you, Mr. Chairman and committee. Currently, a patient that utilizes Tennessee's provider-based telemedicine statute must establish the relationship with an in-person visit, but the patient is also required to have an in-person visit every 16 months to maintain that telemedicine relationship. This bill eliminates the requirement for patients to see the provider in person every 16 months, so Tennesseans will have greater access to providers that are not in close proximity. And with that explanation, pending any questions, so seek passage, Mr. Chairman.
Thank you for your information. We do have 2 people who are listed as available for questions or provide information. Did you have it in mind to have any of them testify?
Mr. Chairman, if the committee's fine with it, I'm happy to vote it out in here, and let's go.
Okay. I think the valuable question has been asked. So without objection, we are voting on House Bill 2857. All those in favor, please say aye. Opposed? The ayes prevail. The bill moves on to Calendar and Rules Committee.
Thank you, Chairman. Thank you, committee.
Members, do we have any other business to come before the committee? Chairman Spicky?
Yes, Mr. Chairman, I want to say thank you for leading an excellent committee this year. I think we're not done yet?
We know, yeah.
We're done. That's right. And so just wanted to say thank you for all the work you've done. And members, I thought we had some really good discussion on some bills this year. And I just want to say thank you for your time.
Well, thank you for your contributions to the committee. Speaker Johnson, you're recognized, sir.
Thank you, Mr. Chairman. I just want to tell you how much I've enjoyed serving on this committee. You're an excellent chairman, and you're always professional. You're fair, and you're considerate. Unlike the chairman of Finance Sub.
You're making it difficult for me to go there.
Thank you, Mr. Chairman.
No, thank you. You're very kind. And you read the script just like we gave it to you. Representative Davis, you're recognized.
I just wanted to say thank you, Mr. Chairman. Obviously, this is not, insurance is not in my wheelhouse, and I'm very grateful to you for your leadership and then also your patience with my learning curve. and you are always available to answer any questions for me, and I'm incredibly grateful to you for that. Thank you, sir.
Thank you. I'm overwhelmed by the kindness. I'll try to remember this on tough days. Representative Thompson.
Okay, thank you, Mr. Chairman. Well, this is my swan song here, just like um, Chairman Johnson here. So, but I've been on this committee all of my 8 years here, and I've certainly enjoyed all of it. It's been stressful, but in some cases, but challenging. And I really appreciate your good, fair leadership in this. And if you're still chairman next year, I'm sure you'll continue with that same atmosphere too. Thank you.
Thank you, sir. I really appreciate it. I really appreciate all the kindness from everybody and the contributions that you have made. Yes, we've had good, important discussions, and we were always kind to each other. Representative Hammer.
Thank you, Mr. Chairman. Just wanted to echo those comments and really enjoyed being on this committee, and also wanted to make sure we thanked our staff. I know how diligent they worked and supported us in this committee work.
Definitely, we could not do it without them. Our staff has been our intern, Jayla. There she is. Jayla. She has a famous name, Jayla Fitzgerald. Our committee assistant, Colleen Johnson, makes everything go. Our research analyst, whose hair I'm always jealous of, is Ryan Vallone. Our committee attorneys, and really, they are the fountains of knowledge. Really, it's been very, very helpful. Caroline Miller and Matt Mundy. Our clerks are Michaela Andrews and Mason Hiskey. And to help us and protect us, our Sergeant at Arms, Mr. Reuben Sanders. The committee stands closed, pending, subject to the call of the chair. Those are the words. And member, once again, thank you for your kindness. I was thinking of having some close.